I would like to thank all the listeners who have turned on their radios and all the viewers who have tuned in their televisions to listen to the address of His Excellency General Yoweri Kaguta Museveni, the President of the Republic of Uganda, on the Ebola virus disease outbreak in Uganda, and I am privileged to present it to you. And the address is dated 26th November 2022. Fellow countrymen, countrywomen, and foreign residents in Uganda, I would like to update you on the progress of our fight against the Ebola Sudan outbreak. You will recall that on 15th of October 2022, I directed a number of movement restrictions into and out of Kasanda and Mubende districts. Those restrictions were aimed at limiting the spread of Ebola virus disease to densely populated areas in Kampala and Wakiso. The first 21 days elapsed on Friday, 4th November 2021. On November 5th, 2022, I directed an additional 21 days to extend the restrictions on movements into and out of Kasanda and Mubende districts, which will end on November 26, 2022. I am glad to note that these measures have worked and we have been able to avert importation of the virus into Kampala. I thank all Ugandans, but more specifically the people of Mubende and Kasanda who have abided with the measures put in place by government. I appreciate the pain of the inconvenience this has caused, but had we allowed the escalation of the outbreak into Kampala, the consequences would have been bad, including possible exportation to our African brothers in the neighboring countries. Since the start of this outbreak in September 2022, the virus had attempted to move from Mubende and Kasanda to Kagadi, Bunyangabu, Chegegwa, Wakiso, Kampala City, Masaka, and Jinja. I am glad to note that we have been able to stop further spread in the districts of Masaka, Chegegwa, Bunyangabu, and Kagadi. The Ministry of Health responded with swiftness to Jinja, and so far over 300 contacts have been listed and put under institutional quarantine. It is now 14 days since the last case in Jinja district, and we have not had any other cases coming from these areas. But those in quarantine must complete the 21 days for us to be sure they are free of Ebola. It may be too early to celebrate any successes, but overall, I have been briefed that the picture is good. As I indicated to you earlier, Ebola is a contact disease, unlike coronavirus, which is airborne. Hence, much easier to control despite its devastating nature. Status of the coronavirus outbreak. To date, 141 people have been confirmed positive for Ebola virus disease. 79 have recovered, while 55 have succumbed to the disease. A total of 6 confirmed cases are still admitted and receiving treatment at both Mubende, 5 and Entebbe, 1 Ebola treatment units. Specifically, the current active admissions are from Kasanda, Mubende, and Kampala districts. Kampala has registered the highest recovery rate of 83%. That is 15 out of 18 cases. While Mubende and Kasanda have the lowest recovery rates at 45%, 29 out of 64 cases, and 42%, which is 20 out of 48 cases respectively. The good outcomes in Kampala were a result of government's quick decision to quarantine contacts and getting them early to hospital while they develop symptoms. The opportunity for immediate quarantine of contacts was lost for Mubende and Kasanda. As the first probable case died on the 6th September, and we got to know about Ebola in Mubende on the 20th September. By this time, the disease had spread to many other sub-counties, as I have previously shown you. The country has been responding to this outbreak for nearly 2 months and 1 week. That is now 68 days. And we have registered successes. As I indicated earlier, we have 3 districts retired from the follow-up list, having completed more than 42 days since the last case of Ebola was reported, coupled with no further spread. These are Kagadi, Bunyangabu, Chegegwa, and 6 districts of Mubende, Kasanda, Kampala, Wakiso, Jinja, and Masaka are still under follow-up. Additionally, we have districts with imported cases, plus or minus secondary transmission, such as Wakiso, Masaka, Jinja, and Kampala. These districts continue to register progress in control of the outbreak, as observed by the number of days since the last confirmed case was registered. For example, Masaka has spent 24 days so far with no secondary transmission. A success just like what we saw in Kagadi and Bunyangabu districts. Wakiso, Jinja, and Kampala districts have spent 17, 11, and 9 days respectively since the last confirmed case. Although Kampala and Wakiso are largely silent, we remain very cautious and alert with heightened surveillance. The epicenters of Mubende and Kasanda have also made progress and a very commendable job in controlling the disease and the spread. However, Recently, one case was identified in Mubende on November 13th, 2022, after the district had gone 15 days without reporting a single case. This is a 23-year-old female medical student from the Eastern Division of Mubende Municipality with a history of contact to an earlier case. It is now 13 days since this latest case was reported in Mubende. Therefore, more work still needs to be done for the district to be completely free of Ebola. Similarly, Kasanda district has shown an improved progress in the response since my last speech. It is now almost 2 weeks, that is 15 days, since the district reported a confirmed case of Ebola. We are cognizant of the challenge of a weak health system, misinformation, and belief in witchcraft, coupled with a single incident of exhumation of a dead body that resulted into a flare-up of cases. I would like to assure the public that we have established a fully fledged response to contain the disease spread. We are very optimistic that the outbreak will come to an end in the coming month. Therefore, to further sustain the gains in control of Ebola that we have made, and to protect the rest of the country from continued exposure, all the directives issued on 15th October 2022, followed by those communicated on November 5th, 2022 by the Honorable Minister of Health, will be extended for another 21 days. Why another 21 days? This is the incubation period for Ebola. The districts of Mubende and Kasanda have only gone 13 and 15 days respectively without a case, and there are 23 people in quarantine in Mubende, while in Kasanda there are 102 contacts under follow-up. This situation is still fragile. Without completing 21 days, as we saw with Mubende, a case can pop up anywhere. It is therefore important that we complete the entire cycle, which will bring us to 17th December. If there is no case, then we open fully. However, if we open now and a case appears, we will have destroyed all the gains made in this war. I therefore appeal for calm and understanding. Our healthcare workers will continue to do all it takes to save lives and bring the epidemic to an end. I call upon the public to cooperate with the healthcare workers and report anybody with signs and symptoms like that of Ebola early enough to improve survival of the patients, but also to protect the rest of the population. Again, I urge you, do not run away from one place to another when you are a contact. Instead, identify yourself to the nearest health facility to get early care. Should you get ill, in addition, spreading the disease to the other parts of the country exposes many people to infection and makes the epidemic more difficult to control. Lastly, I want to thank the people of Mubende and Kasanda districts for understanding the reason for these measures and their commitment and sacrifice. We are relying on you to cooperate and bring this epidemic to an end. I also appeal to the population in Kampala metropolitan area to cooperate and avoid spreading the disease further. Let us work together so that we can have a safe festive season. Finally, I appreciate all the healthcare workers for their tireless efforts, dedication, and commitment to control the epidemic and ensure that the country is safe. Thank you for listening to me, for God and my country. Signed, General Retired Yoweri Kaguta Museveni, the President of the Republic of Uganda, 26th November 2022.
UBC, inspiring Uganda.
Microfinance and saving groups, stakeholders and practitioners are hereby informed that the Microfinance and Savings Groups Conference will take place on the 29th and 30th of November at Hotel Africana, Kampala. The theme for the conference is Drivers for Sustainable Microfinance and Savings Groups. The chief guest will be His Excellency President Yoweri Kaguta Museveni. Physical participation is by invite only. You can also join the discussion on YouTube, Zoom. This conference is organized by supported by. For further information, call.
Over the years, we've dreamed to get onto the world stage. We've had that dream crushed. We've witnessed a total defeat of what could have been our greatest moment. We've felt our spirits go up, only to take a hard fall. We've had our fires burn out and leave only scars. We've seized the wind and had it pulled from our grasp. We've seen pain and we've seen loss of the last fragments of hope. But we are made of resilience, and resilience never stops dreaming. So we will dream even bigger with the Cranes Cup Bowl 2026. Together, let's take Uganda to the next FIFA World Cup.
Together, let's take Uganda to the next FIFA World Cup. For every Now Special you buy, we will give 50 shillings to the Uganda Cranes 2026 fund. You will also get the chance to choose how the Cranes Cup Bowl contributions are spent. Now Special, official beer of the FIFA World Cup and official beer partner of the Uganda Cranes.
Alcohol is not for sale to persons under 18. Please drink responsibly.
Introducing the all-new Roofing's TMX 500C rebars with cut and bend surfaces. Roofing's, strength of a nation.
Get yourself a Zuku TV decoder and satellite dish today at a low price of only 105,000 Ugandan shillings, and a Zuku decoder at only 60,000 Ugandan shillings, and enjoy your favorite movies, series, kids entertainment, music, local and international news, and lots more. Enjoy amazing packages like Zuku Smart, Zuku Smart Plus, Zuku Classic, Zuku Premium, and Zuku Asia. Get connected today. Zuku, life got better.
Get value for your money by choosing the right paint. With Global Paints, you don't just paint, but paint for generations to come. Make Global Paints a paint of choice and make your building a paradise. We have weather coat emulsion, undercoat emulsion, silk vinyl emulsion, flat emulsion, super gloss and high gloss. Global Paint, a reliable product